The color of the skin of your patient really matters. Hello, welcome to Learn with Dr. A. I am Dr. Acevedo. I have 17 years of experience and 10 years teaching about medical aesthetics in the United States, Latin America, and Europe. Today we're going to talk about how important is the color of the skin of your patient and the most important question that you have to ask. That's the previous video I talked about. That the most important question is if your patient tans or your patient doesn't tan at all, and if your patient only gets burned. So that's a big difference, okay? So I talked in the previous video about the two extremes of the phototypes. The phototypes are how the patient reacts to the sun. So I talk about the phototype 1, Ed Sheeran, and phototype 6, Oprah Winfrey, for example, or best, Lupita Nyong'o. Okay, that's the easiest way to learn what is that phototype 6. So we have these phototypes in the middle, from 2 to 5. So these patients could, they could mimetize. You could get confused with those colors. Why? Because a phototype 2 is a patient that is very pale, very white, could have brown hair, blonde hair, green, blue eyes, but also could have brown or black eyes. That patient is going to tell you, I most of the time get burned. I maybe get tan a little bit if I go to the beach every day for 3 days. So that's a phototype 2. Very good example, for example, is Meryl Streep. She's a phototype 2. Okay. After phototype 2, we have the phototype 3. That is, for example, Anne Hathaway. Okay. She's very white, very pale. Her hair is darker and her eyes are darker too. So she's, for example, a phototype 3. And now we have the phototype 4. Phototype 4 is, for example, Jennifer Lopez or myself. So phototype 4 is a very interesting color. Why? Because maybe you could see me very pale, very white. Maybe you could think my color of the skin is like Anne Hathaway, but it's not. I am a little bit darker than her. And why is that? Maybe today, because I have these lights here, that maybe you see me more pale than I really am. But as I told you at the beginning, the most important question is if your patient tans or if your patient doesn't tan at all. For example, I don't know Anne Hathaway, but maybe you ask her, hey, Anne, when you're going to the beach, did you tan or did you burn? Probably Anne is going to tell you, I burn most of the time, but I could tan also. If you ask me, I'm going to tell you, I tan, yes, really fast. I could stay at the sun, whatever, I could be in a high mountain in the beach. If I stay at the sun like 5 minutes, in 5 minutes I get burned. I get tan as this. Very fast, very easily, a very strong color. And why is that? Because here's the skin, there is a cell that the name is melanocyte. I'm going to put it here. So the melanocyte is a cell that has tentacles, okay? Like a squid. Okay, so this squid has tentacles, but also, have pigmentation, have tint, dye. So when the melanocyte that is in this part of the skin here, okay, between the epidermis and dermis, he's there. He's a squid. Remember, he has tentacles to the skin. When it gets, irritated. Or when you pinch them, he's going to, hyperpigmentate everything because of the dye that it has. So this squid that you have, that is the real name is melanocyte, not squid, okay? That melanocyte when it has two kinds of melanin, eumelanin and pheomelanin. What's the difference between that? The pheomelanin, it's yellow. It's not dark. The eumelanin is dark. So the patients that are in the lower part of phototypes, most of the time, they have more pheomelanin. The patients that are in the higher phototype, they produce more eumelanin. And I know maybe you are confused, pheomelanin, eumelanin, oh my God, that's really hard names to get learned. Don't worry. Remember, EU as EU as good. So a good melanin is going to protect you. So when your patient that is like me, phototype 4, that tans very easily, the reason is that my melanocyte, or remember the squid that is being irritated, hyperpigmentate everything because it's protecting me from the sun. Okay, it's protecting me from a laser. It's protecting that skin. So that eumelanin is going to protect me. So as you go lower, the patient gets burned. As you go higher, the patient gets tan. So, in that it's very easy. But what is the important for you? If you're a medical doctor, a nurse practitioner, a esthetician, or if you're a patient that are seeing this, the problem is that you always have to keep that melanocyte calm. He has to be easygoing, relaxed. Because if you push that melanocyte so hard, or if you irritate that skin with a lot of chemical peelings, or very strong chemical peelings, or very strong lasers, you're going to produce a hyperpigmentation that I talked about in the previous video. So that is going to hyperpigmentate everything because the melanocyte thinks, oh, she's attacking me, or someone is attacking me, I have to defend myself. So it, dyes everything, dyes with D-Y-E, not as we are dying. So it's you're going to have a very big hyperpigmentation there. And that's a problem with the darker phototypes. Okay? So I know that, it's very common, for example, here in Latin America, most of us, we are like this. We're a little bit darker, or we're a little bit lighter, but most of us act like a dark phototype. So, and this is the second very important question that you have to ask to your patient. How are your parents? If you know your parents, are your parents darker than you? Are your parents lighter than you? That's a very important question, because maybe here in Venezuela, I can tell you, especially in Margarita Island, you can see a patient that looks like, for example, I'm going to tell Megan Ryan. She's a phototype 2 probably. And you ask to your patient, the patient tells you, oh, I get tan very easily. In 5 minutes I am tan. So even if that patient looks very pale, it looks blonde, that patient acts like a phototype 4. So you have to have that prevention with that patient. So if I want to resume all of these, you have 6 phototypes from 1 to 6. I'm going to put you some faces here. So 1, Ed Sheeran. 2, Jennifer Aniston, Meg Ryan. 3, Anne Hathaway. 4, Jennifer Lopez, me. 5, Halle Berry. 6, Oprah Winfrey, Lupita Nyong'o. Okay? So, for example, you can do to Jennifer Aniston a very medium depth peeling. It's just going to be marvelous. But a patient like me or Halle Berry, you cannot do that. And because we're going to have a hyperpigmentation. And there is also a very important issue here. In the patient with phototype, lighter phototype, they age very fast because of the photo age as the sun goes all through the skin and damage all this collagen. The patient that, as you are dark, you're not going to age as easily as a lighter. But if you are darker, you have another problem. That is a keloid or a very big scar. So when you're going to do, even if yourself, because I know that at this time we have a lot of information at TikTok, Instagram, Facebook, I don't know, a lot of social networks. Maybe you say, oh, okay, I'm going to do myself, I don't know, 50% glycolic acid, because I saw on Instagram that they are very good. Yes, they are good for a patient that is light and lives in Canada probably. But if you live, for example, in Mexico, in Cancun, I don't know, and you live there and you're like me, or you have that, your parents are from Mexico and you have, Aborigines blood, you can have an hyperpigmentation. So remember, we have all these. If you tan, you can get a hyperpigmentation, and also a keloid or a hypertrophic scar. If you don't get tan, if you always get burned, you have to always protect your skin from the sun, because you can get burned and you can have a skin cancer. You're going to age really fast. So if you have any question, please put it there. You can please subscribe to the channel, give a like, comment, and in the third video I'm going to tell you a little bit more about how deep you can go and which are those chemical peelings that goes superficial, medium, or really deep. Bye bye, see you soon.